Let's now proceed to diagnosis according to Sangfu organ patterns with kidney Yang deficiency. Kidney Yang deficiency, in the same way that kidney Yin deficiency is a deficiency of the deepest aspect of Yin, kidney Yang deficiency is a deficiency of the body's deepest Yang aspect. The strength of kidney Yang is inextricably related to the strength of Mingmen. When there is kidney Yang deficiency, Mingmen will be weaker and thereby so will the production of Yuan Qi. This has implications for many of the body's physiological processes. Now let's go to its etiology. Kidney Yang is weakened by food, beverages, and medications that are cold in their energy and temperature, congenital weakness, chronic disease, old age, exogenous cold, hard physical work, and overexertion, lifting heavy objects, standing for long periods of time, and too much sex. Kidney Yang is also weakened by chronic Yang deficiency conditions in other organs. For its symptoms and signs, there will be soreness, weakness, fatigue, or a sensation of cold in the lumbar region, a sore, weak, or cold knees. There will be an aversion to cold, cold limbs, frequent or urgent urination, copious amounts of pale-colored urine, nocturia or enuresis, edema, loose watery stools, mental and physical fatigue, indifference and lack of vitality, wearing warmer clothing than others, tinnitus, dizziness, spontaneous sweating, infertility, poor sperm motility, pale complexion, slow and languid body movements, poor posture, weak libido, shortness of breath, lack of thirst, desire for hot drinks and hot food, pale, swollen, and possibly wet tongue, a deep and weak pulse, and the pulse may be relatively weak in the chair positions. The key symptoms, sore or weak lumbar region, frequent urination or nocturia, aversion to cold, a pale tongue, and a deep pulse. For the treatment principle, we warm and tonify kidney Yang, and we can use the acupuncture points bladder 23, do 4, ren 4, ren 6, kidney 3, and kidney 7. We use the tonifying needle technique, and moxa is also recommended. For further explanation of the choice of points, bladder 23, do 4, ren 6, kidney 3, and kidney 7, tonify and warm kidney Yang. The patient should consume a diet that is warm in both its temperature and its energetic dynamic. They should completely avoid foods and beverages that have a cold dynamic and that are cold in their temperature, especially in winter. In practice, this means avoiding fruit unless it is boiled or baked, salad, raw vegetables, and cold drinks. They should try to use more warming cooking methods when preparing food, such as oven-baked and grilled dishes, which are more warming than steam and cooked dishes. Hot spices such as chili are not necessarily salutary because they will cause the person to sweat and thereby lose heat. Tonifying a deficiency condition is something that takes time and cannot be forced. The use of spices in general is helpful, though, as they can activate Yang. Spices that warm and tonify kidney Yang are cinnamon, cloves, fennel, basil, sage, fenugreek, horseradish, rosemary, and black pepper. Foods that specifically tonify kidney Yang are oysters, smoked fish, salmon, tuna, lobsters, trout, mussels, shrimp, lamb, venison, duck, roast pork, kidney, chestnut, walnuts, pistachio, black sesame seeds, quinoa, oats, buckwheat, millet, aduki beans, black beans, the poor lentils, raspberry, and cherry. Green tea is cooling, so black tea will be better. Otherwise, ginger tea, fennel tea, yogi tea, and jasmine tea will all be good. A person who is kidney Yang deficient must ensure that they get enough exercise. Light exercise is beneficial when there is yang deficiency because it will activate yang and qi. They must, however, be careful that they do not train so intensely that they become fatigued or tired because this will further drain their yang. It is a good idea to start the day with physical activities that can activate and circulate qi. Keeping warm is important, especially in the lumbar region and the area below the navel. Wearing a belly warmer or a woolen stomach scarf around the midriff and lumbar can be recommended. Protecting this area from draft should be a priority. A ginger fruit bath is also beneficial, as is drinking ginger tea. Patients who are kidney yang deficient should avoid activities that weaken the kidneys and yang in general. Besides above advice, men should limit how much sex they have, including masturbation, as kidney yang is expended upon ejaculation. Lifting heavy objects and standing weakens kidney yang and should be avoided as much as possible. Kidney yang deficiency can be caused by the following patterns of imbalance: spleen yang deficiency, kidney yang deficiency, damp, cold, and in turn, this pattern can result to the following patterns of imbalance: spleen yang deficiency, kidney yang deficiency, heart yang deficiency, kidney qi not grasping lung qi, kidney yang deficiency, overflowing water, damp, phlegm, cold, blood stagnation, qi deficiency, and blood deficiency. Thank you for your attention. Ay, sorry. So to summarize, kidney yang deficiency has its etiology in chronic illness, excessive sexual activity, exposure to cold after sex, retention of dampness from spleen deficiency, and old age. Its underlying or accompanying pathology are kidney yin deficiency, spleen qi deficiency, retention of dampness, and its signs and symptoms: lower backache, cold and weak knees, sensation of cold in the lower back, feeling of cold, weak legs, bright white complexion, tiredness, lassitude, abundant clear urination, nocturia, apathy, edema of the legs, infertility in women, loose stools, depression, impotence, premature ejaculation, low sperm count, thin sperm, and decreased libido. The pulse is deep and weak, and the tongue is pale and wet. For the treatment principle, we supplement and warm kidney yang. For the acupuncture treatment, we use bladder 23 to supplement the kidneys, Ren 4 to supplement kidney yin and essence, Ren 6 to foster the original qi and fortify yang, bladder 52 to supplement kidneys and essence, stomach 36 to foster the original qi, do 4 to supplement kidney yang, kidney 3 to supplement the kidney yin and essence, kidney 7 to supplement kidney yang, and the extra point Qigong to supplement kidney yang. We needle the following points with supplementation and moxa. For severe water swelling, spleen 9 and Ren 9. To supplement spleen, large intestine, we use bladder 20, spleen 6, bladder 25, and stomach 25. For heart and kidney deficiency, we use heart 7, bladder 15, and pericardium 6. Thank you for your attention.